Hey everyone, so today we are going to talk about some more cardiovascular drugs, and these will be our diuretics. So they work a little bit differently than some of the cardiovascular drugs that we've already talked about so far in the class, and you probably know these by another name. The very common term for diuretics is water pills. So a lot of times you'll hear patients say, oh, I need to take my water pill today, or I'm picking up my water pills, please. Those are just another word and a more layperson's term for diuretics. Now, diuretics themselves work by decreasing blood pressure, by decreasing blood volume. So what does that mean? It means they act in the kidneys, as you can see, kidneys right over there, by increasing the elimination of salts and water through urination. So number one counseling point on diuretics, you want to tell those patients to take it early during the day because you don't want them waking up at night having to go to the bathroom all the time. The diuretics work by, as we said, increasing the eliminations of salt and water, and that in turn draws fluid out of the body and into the excrement, so through the urine and the stools. Now, side effects with diuretics are exactly what you would expect. You would expect electrolyte imbalances, essentially. The biggest thing with diuretics to remember is hypokalemia. That's low potassium. That's caused by the increased excretion of potassium salts in the urine. So when the patient is peeing a lot, they're urinating a lot, they're going to have an increased excretion of potassium in their urine, and that can cause some issues because potassium, as you'll recall, does have a role to play in not just metabolic processes, but also how well the heart beats and how regular heart rhythm is. So a lot of times we might need to supplement potassium in these patients who are taking diuretics. So that might involve taking a potassium vitamin, a multivitamin, all depends on the patient and their level of potassium control. Now, we have the notable exception of spironolactone and triamterene. They can cause hyperkalemia. That is an increase in potassium because they're what's known as potassium-sparing diuretics, which we'll talk about later. And as I said, electrolyte imbalance and dehydration is always a key problem that you have to be sure of. That might cause fatigue, cramping, and dizziness. So those are the signs that maybe we need to adjust the dose of this diuretic or get the patient off of that if that becomes too serious of an issue. Also, as you would imagine, these patients are losing a lot of fluid. So it's really important to drink an adequate amount of water while taking diuretics. Now, just to give you an idea of what we're looking at when I'm talking about how the diuretics work in the kidney, you'll hear me use some terms that refer to this cell, which is called a nephron. So the nephrons are the basic filtering units within the kidneys. The kidneys have thousands and hundreds of thousands, and honestly, maybe even a million, not sure exactly on it's been a while since I took the anatomy. But the main thing is, this is what one of those little kidney cells looks like. And that is how those kidney cells filter the urine, right? So they take these ions and waste products out of the blood. They go into the kidney. They follow this path right here. They go through these different loops where they get filtered out. And you can see there's the loop of Henle. We'll come back to that later. And it eventually gets excreted out of the kidney into the ureter and into the bladder, where it's eventually urinated out of the body. So we have those diuretics. They're working in that part of the kidney. Obviously, you don't need to know this for the exam, but I think it's good that you have context for exactly how these drugs are working. Now, firstly, we come to our thiazide diuretics, and you will see these all the time. They're first-line agents, meaning they are the first choice of doctors to prescribe these things for patients who might want to lower their blood pressure, as well as they're also very useful in treating fluid retention or edema in chronic heart failure patients or CHF patients. A lot of times when a person has chronic heart failure, they retain a lot of fluid in their body. So it makes sense that you would prescribe them diuretics because you want to get rid and excrete as much of that fluid as possible. So your side effects of thiazide diuretics are what you would expect. Hypokalemia, that's low potassium, dizziness. You might have photosensitivity. So these patients might have to wear sunscreen outside. They might burn a little bit easier in the sunlight. And a rash is also possible, if unlikely. Generally, these are very well tolerated drugs. Now, hydrochlorothiazide is also called microzide. And you can see the name of the diuretic is right in that name, hydrochlorothiazide. It's thiazide diuretic. It's often abbreviated, though, to HCTZ. And you'll notice it's a very, very common diuretic used in combination drugs. So a lot of the, you'll see ACEs and ARBs that will also have the hydrochlorothiazide included in them already. So the patient can only take one pill instead of two. Now, hydrochlorothiazide also comes in liquid as well, tablets and capsules. Metolazone is the other thiazide diuretic that you might come across, otherwise known as Xeroxilin. And that's preferred in patients with renal impairment. So if their kidneys aren't working that well, it's good to prescribe the metolazone over the hydrochlorothiazide. Next, we have our loop diuretics. So you'll recall that nephron, those kidney cells that we just looked at, these loop diuretics act in what's called the loop of Henle, this big thing right here that's inside those kidney cells that are filtering that urine. Now, they work by increasing the excretion of salts in the loops of Henle specifically. So it's getting those salts into that loop and specifically bringing those salts into the loop out of the body through that urination. Now, they're very, very similar to the thiazide diuretic and indeed all diuretic side effects in terms of profound diuresis. Diuresis is just a fancy term for they need to pee a lot. Lots of urination, increase in the volume of urination. So again, hydration is key with loop diuretics. Hypokalemia, that's low potassium, again, as well as that photosensitivity we talked about. They might burn easier in the sun. The thing with loop diuretics to remember that they may potentially want you to pick out on the exam would be the fact that they have ototoxicity. So you'll recall auto, that Latin root, has to do with the ears, right? And toxic, meaning could be detrimental to it. So a lot of times this manifests as tinnitus or ringing in the ears. Ototoxicity can happen with loop diuretics, and you may want to switch someone out if they're having hearing loss or having that persistent ringing in the ears while they're taking those loop diuretics. Now, a lot of them are easy to remember in the sense they all end, at least those brand names all end in X or Ix. So you have bumetanide or Bumex, tablet or liquid. We have furosemide, again, one that's really, really common. You'll see it in the hospital too. It's very often injected. It's commonly used in hospitals, tablet, liquid, or injection. And by injection, I mean IV. And torsemide, Demodex, which is tablets. And lastly, we have our potassium-sparing diuretics. So you'll recall that a lot of these side effects have been, they affect the potassium levels, whether it's hypokalemia or hyperkalemia, right? So because hypokalemia can cause irregular heart rhythms, low-star arrhythmias, people at risk for these heart conditions might require potassium-sparing diuretics. That is, the potassium is spared from being filtered out excessively in the body, and those patients are able to retain their potassium while still getting that benefit of the diuretic to decrease their blood pressure. It prevents the loss of potassium that comes with increased urination, and they're sometimes added onto other diuretic therapy as well, because a lot of times they don't work completely well by themselves. However, it's important that you can have the opposite problem as most diuretics when it comes to potassium-sparing diuretics, and that's hyperkalemia, a heightened potassium level, which can also cause issues potentially if someone has heart conditions. They also have a gynecomastia or breast tenderness. So enlargement of breasts of the breast can cause tenderness of the breast as well. Dizziness as well, especially upon standing, because think about it, you're lowering the blood pressure. So if you get up too quickly, you're going to have potentially some issues with dizziness upon standing. So tell them to take it easy until they understand. And there is a possible side effect or adverse event related to some potassium-sparing diuretics is that it might potentially cause tumors. This is really only in patients who might be at an increased cancer or tumorous risk. It's not very, I will say I've never had a patient or seen a patient who specifically had something that could be traced back to a potassium-sparing diuretic in terms of tumor growth or anything, but it's just something to keep in mind, especially if the patient may have a history of tumors, even if they are benign. And the main one for the potassium-sparing diuretics would be spironolactone or aldactone, and that just comes in tablets. So super easy to remember. If you have any questions, feel free.